You might have something right now, inside your body, that is slowly damaging your sperm. No pain, no obvious symptoms, no warning. And if nobody's ever checked, you have no idea it's even there. It's called a varicocele. It affects up to 40% of men dealing with fertility problems. And almost nobody is talking about it. Not your GP, not your partner's fertility clinic, not the internet. Because when you search male fertility, you get articles about diet and sleep and stress. You don't get this. Let's start with the basics. And I'm going to call this section exactly what it is. What is a varicocele? Listen carefully. You know what a varicose vein looks like in your leg? That same thing is happening inside your scrotum. A varicocele is a dangerous enlargement of the veins inside the scrotum. It chokes off blood flow. It raises the temperature around your testicles, and it is actively destroying your sperm. This is not something you ignore. Inside your scrotum, running alongside each testicle, is a network of veins called the pampiniform plexus. Their job is simple: drain blood away from the testicles back toward your body. A varicocele happens when those veins stop draining properly. The blood pools. The veins enlarge and become twisted. Think varicose veins on your leg, but inside your scrotum. Same mechanism, same root cause, just a very different location with very different consequences. Varicoceles almost always develop on the left side. Around 85% of cases are left-sided. This is because of the angle at which the left testicular vein drains. It connects directly into the left renal vein at a sharp 90-degree angle, which creates more resistance to blood flow. The right side drains more directly into the inferior vena cava, so it's less prone to this problem. They're graded on a scale from 1 to 3. Grade 1 is small, only detectable with an ultrasound. Grade 2 can be felt during a physical exam. Grade 3 is visible to the naked eye. You can actually see the enlarged veins through the skin. Here's the number that matters. Varicoceles are found in about 15% of all men. But among men investigated for infertility, that number jumps to 35 to 40%. That's not a coincidence. So what's the actual mechanism? Why do pooled veins in your scrotum have anything to do with sperm quality? Here's where it gets interesting. Your testicles need to stay cooler than the rest of your body to produce healthy sperm. This is why the scrotum exists. It keeps the testicles a couple of degrees below core body temperature. When blood pools in varicocele veins, it raises the local temperature in the testicle. Even a 1 to 2 degree increase is enough to disrupt sperm production. At the cellular level, the cells responsible for making sperm, Sertoli cells and Leydig cells, are highly temperature sensitive. Keep them slightly above their optimal range, and sperm production slows, weakens, and distorts. But temperature isn't the only problem. Pooled blood also carries less oxygen than normal flowing blood. This creates oxidative stress in the testicular tissue, free radical damage that directly attacks sperm DNA. We're not talking about abstract cellular damage. We're talking about sperm with fragmented DNA that can't fertilize an egg properly, or that leads to early miscarriage even when fertilization does occur. On top of that, varicoceles are associated with elevated levels of reactive oxygen species, toxic molecules that damage both sperm membranes and their mitochondria, which are the energy source that sperm use to swim. Damaged mitochondria means slow, sluggish, or immotile sperm. The result? Men with varicoceles consistently show lower sperm count, reduced motility, meaning fewer sperm that can swim properly, and higher rates of abnormal morphology, meaning misshapen sperm. The research is clear. Varicoceles cause measurable, reproducible damage to sperm parameters, and the damage gets worse over time if left untreated. If you've had a semen analysis come back with low count, poor motility, or high DNA fragmentation, and nobody mentioned varicocele, watch the next 2 minutes carefully. This might explain everything. Now let's talk about symptoms and diagnosis. Here's what makes varicoceles so dangerous from a fertility standpoint. Most men have zero symptoms. Some men describe a dull ache or feeling of heaviness in the scrotum, especially after standing for long periods or after physical activity. Some notice a visible bulge or what feels like a bag of worms texture on the left side of the scrotum, but a significant proportion of men, particularly those with grade 1 or grade 2 varicoceles, feel nothing unusual at all. This is why routine physical examination matters, and why it's one of the most underused tools in male fertility investigation. Diagnosis is typically done in two ways. First, physical palpation. A doctor examines your scrotum while you stand upright and perform the Valsalva maneuver, which is basically bearing down like you're straining. This increases venous pressure and makes enlarged veins more detectable. Second, scrotal ultrasound with Doppler imaging. This is the gold standard. It measures the diameter of the veins. Anything over 3 millimeters is considered clinically significant, and the Doppler component detects reflux, the backwards flow of blood that confirms the valves in the vein are failing. If you've never had either of these done and you're dealing with fertility issues, you need to ask for them. Specifically, because they are not always offered as standard. Now, the most important question: can treating a varicocele actually improve your fertility? The answer is yes, but the details matter.
Hey, before we go any further, I just want to take a moment, because what I'm about to share, it really matters. If you've been feeling frustrated, or even a little embarrassed, about changes in bedroom performance, sensitivity, stamina, or desire, please know this: you are not alone, and it is not your fault. So many men go through this, quietly, privately, carrying it all by themselves. But there is hope, a 100% natural solution that has already helped thousands of men feel confident, energized, and like themselves again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make right at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. If any of this resonates with you, please don't wait. There's a link in the description and in the pinned comment. Check it out. It could be exactly what you've been looking for. Okay, let's get back to today's topic.
There are three main treatment approaches, and they all aim to achieve the same thing: cut off blood flow through the damaged veins so the testicle can recover. Option 1. Surgical varicocelectomy. This is the most common approach. A surgeon makes a small incision in the groin or lower abdomen and ties off the affected veins. Blood is then rerouted through healthier veins. The procedure is typically done under general anesthetic, takes around 30 to 45 minutes, and recovery is 2 to 4 weeks. Multiple meta-analyses, large studies that pool data from multiple trials, show that surgical varicocelectomy significantly improves sperm count and motility in men with clinical varicoceles and abnormal semen parameters. A 2021 meta-analysis found that surgical treatment increased natural pregnancy rates and improved IVF outcomes in couples where the male partner had a confirmed varicocele. Option 2. Percutaneous embolization. This is a minimally invasive procedure performed by an interventional radiologist. A catheter is inserted through a vein in your neck or groin, guided to the testicular vein, and a coil or sclerosing agent is used to block the vein from the inside. No large incision. Faster recovery, often just a day or two. Comparable outcomes to surgery for most patients. Option 3. Watch and wait. For men with grade 1 varicoceles and normal semen parameters, observation without treatment is often appropriate. Not every varicocele requires intervention. The decision to treat should be based on the grade of the varicocele, semen analysis results, and your fertility goals. One important note on timing: Sperm take approximately 74 days to mature. That means even after successful treatment, you won't see the full benefit in a semen analysis for at least 2 to 3 months. Most studies measure outcomes at 3 to 6 months post-treatment. So what do you do right now? If you are trying to conceive and haven't had a male fertility workup, this is what you should do. Step 1. Get a semen analysis. Not a home test. A clinical analysis at a certified lab that measures count, motility, morphology, and ideally DNA fragmentation. Step 2. See a urologist or andrologist, a specialist in male reproductive health, not just your GP. Request a physical examination of your scrotum, and if there's any question, a scrotal Doppler ultrasound. Step 3. If a varicocele is confirmed and your semen parameters are abnormal, have a direct conversation with your specialist about treatment. Ask specifically about surgical versus embolization options, expected timelines for improvement, and what the evidence says for your grade and situation. Step 4. While you're investigating and deciding, support your sperm health with the fundamentals. Avoid heat exposure to the groin, hot tubs, laptops on laps, tight underwear. Optimize your intake of antioxidants, including CoQ10, zinc, and selenium, and address any obvious lifestyle factors like smoking or alcohol. These steps don't replace treatment, but they give your testicles the best possible environment to recover. Let's bring it all together, the full recap. A varicocele is an enlargement of the veins inside the scrotum that impairs blood drainage from the testicle. It affects up to 40% of infertile men and is frequently missed because it often causes no symptoms at all. The damage it causes to sperm through heat, oxidative stress, and reduced oxygen is well documented and progressive. Diagnosis requires a physical exam and ideally a Doppler ultrasound. Treatment through surgery or embolization has strong evidence behind it for improving sperm parameters and fertility outcomes, and the timeline from treatment to measurable improvement is at least 3 months. If you've been dealing with unexplained male infertility, or if a semen analysis has come back with abnormal results and nobody's checked for this, now you know what to ask for. If this video gave you information you've never heard before, share it. Because there's another man right now watching his partner go through IVF cycles, who has no idea this is sitting undiagnosed in his scrotum. That man needs this video. Subscribe if you want more content on male fertility, blood flow, erectile dysfunction, healthy aging, and testosterone boost. That actually goes deep. Not surface-level tips, but the real mechanisms, the real research, the real options. And drop a comment below. Have you ever been checked for a varicocele? Yes or no? I want to know how common this knowledge gap actually is. Remember to check out the 100% natural home remedy thousands of men are using to boost stamina and energy in the bedroom. No pills, no pumps, no surgery. The link is in the description and in the pinned comment. Now, watch this video where I break down 3 everyday foods already in most homes and kitchens that produce a lot sperm in men. It's shocking, but pleasantly shocking.